welcome to Mommy Mundo's podcast. I'm Janice Villanueva, founder of Mommy Mundo, the most active multi-platform resource and community for moms in the Philippines. This podcast is another way for us to reach you, our fellow mamas, share information and stories about parenting, another way for us to help and inspire and empower each other. We at Mommy Mundo are mom's number one fan, cheerleader, and motivator. Thus, the title of this podcast, You the Mom. We cheer you on, mamas. So, thank you for joining us on this episode of You the Mom. And this month's theme is all about pregnancy. In today's episode, we have our guest who will talk to us about all things pregnancy and especially about being pregnant in these very uncertain times. So, it's pregnancy during the pandemic. So, our guest today is a fellow in the Philippine Obstetrician and Gynecological Society and a fellow in the Philippine Society for Gynecological Endoscopy. She handles gynecological endoscopy and robotic surgery and obstetrics and gynecology at the St. Luke's Medical Center in the Global City and in St. Luke's, Quezon City. So let's all welcome Dr. Camille Ann Abaya. Hello, Dr.
Hello. Hi.
Camille.
Hi,
So Dr.
Janice. Thank
Camille is
you.
known as Dr. Milan. Are
Yeah.
you more
Okay.
known as
Just
Dr.
call me,
Milan?
not really, but okay lang. Just call me
Doctor,
Milan.
yeah.
It's okay.
Welcome.
Thank you. Thank you for inviting me here.
Thanks for saying yes. I know things are not normal these days and it's a bit busy. So I really appreciate your accepting invitation. I've known Milan since she was in grade one.
Yes, that's true.
um, and I'm happy we're still in touch. And of course, happy that you're a doctor now and helping a lot of people. I follow you on social media and I see the birth that you sometimes post there. And I always ask you and sometimes wonder how it is now during these times, right? So how's it been in
Yes.
the hospital?
Pretty challenging. We do get our fair share of pregnant women who are positive with COVID.
Yeah.
Um, uh, Sometimes they are asymptomatic. Most of the time, they are asymptomatic, and
Mm-hmm.
we only find out that they are COVID positive right before they're going to give birth because we do in St. Luke's where I practice, we
Yeah.
do have mandatory PCR swab test done a few days before the delivery. So sometimes that's the
Okay.
only time they find out that they're positive.
Oh, okay. It's like we're diving in right away,
Yeah.
right? So
Okay. Go.
thank you
I
for
gave you
that
an
intro.
opening.
Yeah, yeah. Actually, I wanted to do this episode because, of course, right now, especially, there's so much anxiety around the pandemic. But there's a different level of anxiety for pregnant women and pregnant couples, of course, expecting moms and dads. And I think information is key. If we're able to prepare on top of all the things that a pregnant woman would normally prepare when she's pregnant and about to give birth, the more now. So there is a bit of a challenge, but hopefully through this episode we'll be able to share with you some inside information from the doctor herself, right? So um first of all, let's start from the beginning, I guess. If Let's start from the testing if you're pregnant. So right now, if you think you're pregnant, so normally before you'll buy a pregnancy test kit in the pharmacy and then do it at home. And then eventually, of course, if it's positive or if there's questions about the test, then you go to an OB, right?
Yes.
So how is it now during the pandemic?
So basically, the main steps are still the same. It's still there. So of
Okay.
course, my patients will do a pregnancy test when they miss their period, and then they're going to
Yeah.
contact their OB-GYN, right? So the next
Yeah.
step, as you know, would be an ultrasound at some point in the first trimester. So that still holds. Okay. So I guess
Okay.
before I start detailing everything, so that like
Sure.
our moms who are listening, the only real difference, okay, aside from the many things that you have to learn in pregnancy or about getting pregnant and the journey in pregnancy, the only difference is number one, you have less live consultation. And then number two, right before you give birth, you're going to have a swab test. So really, if you think about it, there's
Okay.
nothing to worry about. Parang dalawa lang inadagdag. In fact,
Okay.
the first one is even better because you don't have to leave your own home, right?
That's right. That's
For
right.
all of your checkups, okay? So
Yes.
those are just the two, just to give you a clearer picture. So
Yeah.
okay, so we mentioned, okay, we'll have a positive pregnancy test, and then we'll do the ultrasound. So usually this is
Yeah.
case to case. We can't generalize, no? Each obstetrician or your obstetrician can have a different um, attack on how to help you or how to take care of you during your pregnancy. But generally, it's the main would be the same. Okay, so there will be a
Yes.
first trimester or the first 3 months you'll have a transvaginal ultrasound. Um,
Yeah.
some OBs may say, okay, I'll see you in clinic for the first time. No, others may say,
Okay.
okay, let's do teleconsult first. Let me know what your results are. Then I'll see
Yes.
you in clinic maybe at around 3 months or 4 months when we can actually get the heartbeat of the baby in the
Mm.
clinic. No, so
Okay.
but generally our society, the Philippine Obstetrics and Gynecological Society, has given some kind of like guidelines. No, so you don't need
Okay.
to do every month consultation in clinic or live. So normally,
Okay.
you need to do every month consultation until about the 7th or 8th month, where you do 2 times a month, and then on the 9th month it's weekly na.
Mm.
All right.
Okay.
So for this, we still generally follow that recommendation, but let's say for the first month we can do telemedicine lang muna, and then on the second
Okay.
month I can ask you to come in, you can hear the heartbeat of your baby, check everything, and then okay na. So this is what I do
Yeah.
in my practice. No, so as I
Okay.
said, maybe your obstetricians will have different
Yeah.
strategies, but it's more or less the same. In other words, the actual live consult is less. So I'll do like
Okay.
an every other month kind of live consult. And then I
Yeah.
have like, so you're going to have like milestones, like on the 6th month, because you can check and you'll have another ultrasound at that time, congenital anomaly scan, they'll check your blood sugar at that time.
Yeah.
I can ask you to come in. And then
Okay.
maybe we'll
Okay.
see on
I'll
the seventh
I'll
month.
pause you
Ganyan. So,
there. Yeah, I'll
okay.
pause you there, but I love it. So that's two things. It's the just the two changes, which is the live consult. No, it's not the
Yes.
same depending on the doctor. And the
Yes.
second one is the test before you come in for labor,
Yes.
right?
The PCR
Okay.
swab test.
PCR swab test. Okay, I
Yes.
have a question. The first thing is, so kasi 'di ba when you find out you're pregnant, you have to look for an OB. So normally they find you, for example, and then
Yes.
they contact you, set an appointment
Yes.
for a call, online call first. So that's also interesting, right?
Mm-mm.
So how do you do the? Because I'm coming from, of course, the pre-pandemic period. Well, mine's ages ago pa.
Okay.
But anyways, so how do you do the checkups? Is it like, for example, you measure the girth or things like that? You have instructions for them, and then
Very good
just
question.
questions. Yeah. So
Yeah.
how does it go? Like because I've never had the telemedicine
Telemedicine. Okay. So
checkup. Yeah.
in detail, so it's still the same. Again, different OBs will have different strategies to it. Some will really have they will be texted, and then parang they
Mm,
talk to their OBs one on one. As for me,
yeah.
because I consider it kind of like a clinic, my secretary actually also is involved. So she
Yes.
schedules everything online. You go through her, and then we give you the link. I use Google Meets, or some
Mm,
people use Zoom, some people use Viber. So
yes.
okay, so in the teleconsult, when you're actually online, yeah, so we check like, oh, how are you? Are you feeling the baby's movements? And then it's
Yeah.
a good thing that you ask about like the abdominal girth
Yeah.
and like all these, no? So for me personally, this is what I do. I ask my patients at the initial consult if number one, do they have a weighing scale? Number two, do they have
Mm,
a BP
yeah.
app? Number three, it would be nice, but it's not a requirement if they buy that fetal Doppler. You
Yes.
can
Yes.
actually buy it in the mga online.
You
Can I
can buy
like
that
say,
already
yeah, can
on
I say,
Lazada like that.
oh, ganyan, I can say that. Okay, so
You can
Lazada,
really buy
Shopee,
anything in Lazada.
yeah. So
Doppler.
there are cheaper ones na
Cool.
parang it's 2,000, 3,000, ganyan. Sabi ko, I said, of course, don't buy what we have that's medical grade, but just buy like yung mga little ones na
Yeah.
2 to 3,000. So when we have our checkup, when the baby is a little bigger. So remember, I told you earlier, at 3 months, I asked them to come into clinic for me
Yes.
to listen to the heartbeat. Kasi at
Right.
3 months, it's quite difficult to get the heartbeat with just a regular, the
Yeah.
medyo lower end. Okay, so you
Yeah.
need a kind
Yeah.
of higher. No, but later on, when they become 5, 6, 7 months, it's so
Yeah.
easy for you to do it yourself. So I said,
Right.
okay, it's not a requirement, but it would be nice if you have a little extra cash to buy this. But also, if you're like kind of scared, parang I didn't feel my baby moving,
Yeah.
I can just like, and okay, nandiyan pa yung heartbeat. Okay.
Yeah. Yeah.
So in
Correct.
checkup, what I do is, okay, can you weigh yourself? I
Yeah.
also ask them to have a little notebook, parang like a
Okay.
diary. Okay. So,
Yeah.
um, so yeah, so what's your
For
weight? Okay,
tracking. For tracking.
correct. So, okay, this is
Okay.
the date. What's your weight? What's your blood pressure? So they'll take their blood pressure in front of me while we're doing. So
That's
it's just
using an app or a
no,
sphygmomanometer.
a
If they have
sphygmon.
one.
Yeah,
Okay.
if they have one, usually naman people have weighing
People
scales
have
and
already.
sphygmon. Yeah.
Yeah.
And
Okay.
then, if they have the Doppler, I say, okay,
Okay.
can we listen to the heartbeat? Is it
Ah,
okay? Sige, you lie down or ganyan, ask your husband or whoever. Sometimes they do it themselves. If they don't have,
okay.
then I'll just ask like, oh, is the baby moving well? Ganyan. So it's
Yeah.
like it mimics the kind of
Yeah.
checkup that you're gonna have in clinic, except
Yes.
we have to be a little bit innovative. Na parang, oh,
Right.
ikaw
Right.
na yung gumawa nito, ikaw na yung gumawa
Yeah,
nito.
which is totally fine actually, no?
Correct.
And
Yeah.
as you said, there's pros then, like before we would have to brave the traffic and
Correct.
wait in the clinic and all that.
Yes.
So, okay. Oh, that's
Yeah.
interesting. Okay.
Mm.
Okay. So now that we know you're pregnant and then you have all the checkups for if you go to the hospitals, well, this is for St. Luke's. Is it difficult to get an appointment? And is how are the protocols in the hospitals? Like what should they expect when they go in the hospitals? Normally, you think lang of hospital now, you're like, oh my God, I don't want to go there. But of course, for pregnant women and other people who have urgent tests and stuff, they have to go. So,
Yeah.
what can they expect when, for example, they go to St. Luke's? How is it in terms of the testing areas and things like that?
Okay. So
Yeah.
it changes kasi the pandemic has, it's very
Yes.
fluid now, no? Anything can happen talaga. So in the initial part of the pandemic, of course, our
Yeah.
clinic shut down for that whole ECQ, no? And then we
Yes.
started opening up again. So our clinic started opening up again. And there was a triage system. So at that time, what you would expect was you would need to have an appointment slip from your doctor printed out, show it, fill
Yeah.
up like all these health declaration forms. You cannot go straight to the elevator to go up to your
Mm,
doctor. You have to pass through a triage. So that
okay.
went on for quite some time, and then it
Yes.
opened up a little more, and they removed it. Okay, so now you can actually
Okay.
walk in na. You can go straight to your doctor's clinic, except
Clinic.
that of course mandatory, as like in any other complex or building that you enter, you have to have a health declaration. Okay, so
Yes.
that
Okay.
happened.
Yes.
Right now we're in a surge. They haven't changed. They
Yeah.
haven't changed their protocol. Still health declaration. So as long as you have a schedule. So, but the challenge now is that your doctors are not always there every day. So you really have to
Yes.
have a schedule. I mean, there will be a few who go every day, but hardly
Yeah.
will you see a doctor who does the regular clinic hours like before.
Yes.
So
Right.
you really have to correspond with the secretaries to make sure that you have an appointment on a certain day
Yeah.
and you can just come in. Okay. I guess here I want to kind of dispel the fear of going to hospitals because
Yes. Go
our
ahead.
patients are
Yeah.
always scared. The parang doc, is it safe like that? For me,
Yes.
no. In fact, even especially during the first few months, like mga June, July, August, no one wanted to go to the hospital. It was so bare.
Yeah.
The corridors to our clinics, walang tao. So I was wishing if only people saw this, they'd love to go and have their checkup, kahit regular
True.
checkup lang, because there's really no one there. It's so safe. And then,
Yes.
so I say now, your risk to go to the hospital in a clinic, like an OB clinic or like
Yes.
ultrasound, it's just probably the same risk as you'll have as going to a grocery,
To the grocery.
interacting.
Maybe
Yeah,
even less because there's less people.
correct. I think maybe
Yeah.
even less because your healthcare workers are totally covered in
Yes.
PPE. So at least we
Right.
won't give you anything, right?
Right. Right.
Um, versus like you guys eat out, diba? That's so
Correct.
much
That's
more of
true.
a risk rather than
That's
having
true.
an ultrasound, which is 10-15 minutes, no?
That's
I just
true.
want to say that. And then
Yeah.
also kasi,
Okay.
yun nga, the perception that, but diba, St. Luke's is full. There's so many COVID patients. But you see, the COVID areas, or what we call the hot areas, are totally different from the areas where
Yeah.
the
The
pregnant
medical
women
arts
are going to see.
building.
Correct. The medical arts
Yeah.
building, the transvaginal ultrasound building, the
Yeah.
ultrasound section, the laboratory, it's different. So, of course, it's different if you're going to enter the ER, right?
Yes.
Or if you're
Yes.
going to go to that wing where all the COVID
Yeah.
patients are, or to the ICU. But you're not even going to pass there. And, depending on, like, St. Luke's Global City is so huge.
Right.
Quezon City, although a little bit more logistically small, or the actual building is smaller, but we've sealed off the areas. Basta we turn it
Okay. So
into
it's
a COVID ward.
contained.
It's contained.
Yeah.
It's sealed.
Yeah.
There's like, you won't even know it's there. So I guess
Right.
that's one thing. No,
That's
I
good.
want to
That's
take
good.
this opportunity
Yeah.
that don't be afraid to go to the hospital.
Yes. Yeah. Okay. That's a good and that's a myth to dispel, I guess, no, in terms of
Mm-mm.
the fears. Of course, everyone is paranoid, which is also good naman, but then at least we know now that
Yes.
it's okay, it's safe. But then set an appointment to make
Yes.
sure that
And
your doctor is
just if
there.
you have to go, just go,
Yeah.
right?
Yes. Okay, so we've done that part, the pre-pregnancy and the checkups. Okay, how
Mhm.
now do you plan for the birth, for labor and birth? So
Okay.
that's another thing. Like normally we would plan for what to put in your hospital bag and then what to do when you feel labor pains. So how does it go now that there are tests to be scheduled and things like that?
Okay, so
Yeah.
in terms of what to prepare and what to put in your bag and all that, it's the same lang, no?
Yeah.
Okay,
Yeah.
I guess the difference is, so like number one, right now, they kind of stop water births. Okay, so
Ah,
at
right.
least in the institution where I practice out of, all right? That's why
Yes.
some women would choose to have a
Home
birthing
birth.
at home. Yeah,
Yes.
because of that. They've
Right.
stopped water birth because the water and then the additional people there.
True.
You usually have doulas, you should have midwife, you have your husband. You know,
Right.
when we're dealing with the pandemic, we would really like to have less people as much as possible with you. No, so unfortunately,
Yeah.
that is the situation now. Okay, but if you're going for just a regular normal birth or you're going for cesarean section, it's just the same. However, in St. Luke's and in most hospitals, actually, they require at least a PCR swab test. Now, again, as I said,
Okay.
it's changing, right? So
Yes.
initially, when they gave out the notice, they said, okay, no husbands, no water birth, wala talaga, zero, swab test the patient, valid for 14 days. Okay,
Okay.
so that went on
Yeah.
for a while. And then biglang we were clamoring because our patients wanted their
Yeah.
husbands to be there in the support system. So when it got a little better, right? So of course the
Yeah.
initial reaction of the institutions will always be to be very careful, shut
Yeah.
down everything, only
Conservative,
the
right?
patient, very conservative. Then
Yes.
clamoring, the cases were going down. Okay, husbands can now
Husbands.
enter. Swab
Okay.
test of the mom is still valid for 14 days, but the
Okay.
dad has to have a swab test every 5 days. And people
Okay.
followed it. So parang kahit
Yes.
every 5 days nagpapaswab si daddy, okay lang.
So
Because they
leading to the
really
due
want.
date, swab, swab, swab. Like you
Correct.
just have to
Yes.
keep.
Remember,
Ah.
37 weeks, diba? That's your due
Yes.
date. 37, 38, 39, 40. So
Okay.
we plan it along those
Okay.
strategically, when are we going to have the swab test? If you want to be
Okay.
super sure, you can do it here, then do another one here, right? Because it's every 2 weeks
Right.
lang. But we
Yes.
can kind of, we predict it. So I discuss it with
Okay.
our patients. All right.
Yeah.
And then what else? So, okay. And then
Yeah.
now that there's a surge, it's suddenly now women, validity is only 7 days,
Okay.
and then no husband again
Ah, no husband
for
again.
now. Okay. So
Yes.
it's
Yes.
changing. It's changing. So if your
Right.
due date is about now, then this is probably what your obstetrician will tell you.
Okay. So this
But
is in St. Luke's, or is it
at
a
least in St.
blanket?
Luke's, no, it's
The
not a
one with no
blanket.
husband,
No, it's
it's
not a
not
blanket.
blanket.
No, no. So
Okay.
others
Okay.
will have different.
Okay.
Yeah. So wait. Okay, and then they changed it. Sorry, I'm so
Yeah.
confused.
No,
Now,
no, no. Go ahead.
pwede na ulit the husband.
Okay.
3 days validity, I think, of the swab.
So just stricter.
So
Stricter.
stricter, yeah. So
Yeah.
mga ganyan. So companion can be as long as they have a swab test. So also,
Okay.
you can't have more than one companion. Your companion has to be
Yeah.
swabbed as well. So that's the husband na.
Yes.
When
That's
your
why wala
husband,
nang dula and stuff kasi it's
wala
hard.
na talaga. When your
That's
husband
right.
comes in with you to the DR, hindi siya pwedeng in and out.
So
Once
he
he
stays
enters,
there.
he stays there with you until the end, because that puts
Okay.
the whole DR at risk, right? If you're gonna go
That's
out to buy
right.
food and then come back in.
So is
So
there like a husband area, or does he stay with his wife?
usually they want to stay with their wife naman.
Yeah.
So
Yeah.
yeah, if you don't want to go, if you don't want, there is a husband area, but you have to have a
Yeah.
negative swab test. So right now, policy
Okay.
of St. Luke's is all patients and all bantays.
Yeah. So it can be the husband or a birth partner or anyone, or the mom
Correct,
or something.
correct. But
Okay.
then that's
Yeah.
just one. If you have
Yes. There's
designated
one.
that one, the other one can't
Yes.
like come in anymore. So
Yes.
again, these are
Okay.
changing, and we expect it to get
Yeah.
better maybe when the surge passes.
Right. Okay. So thanks for that clarification and that info. I did sense a lot of anxiety that the husband couldn't be there. You know,
Yeah,
naman also, as of course, of course, husband should be there. The daddies are
yes,
anxious also and excited to see their babies and be with their wives and stuff. And also they've practiced like breathing together and things like that. So
yeah.
hopefully it'll be fine. But wala na yung entourage, di ba? Usually
Wala na
Filipinos may
yung
entourage.
lolo, lola, wala na. And they're also afraid, actually.
Yeah,
But you know
yeah,
what, Janice? The good thing is, like at the start of the pandemic, when we were telling the
yeah,
husbands the sorry you can't enter, they
yeah,
understood. They
yeah.
understood.
Right,
No one
right.
really, I mean, people understand this is a pandemic. We're not doing it to
Yes,
make you guys suffer. And then
yes,
so they understood. And then for those who really weren't comfortable, then they just moved to
yeah.
home birth. A few of them. But
Yeah, pero
generally most kasi would still like
yeah,
a hospital birth for
hospital.
any complications, right?
That's
So
right.
that's what you're going for.
Safer. Yeah,
Yes,
correct, correct. Okay, so that's with the husbands, that's okay.
mm,
At least it's eased up. Of course, at the beginning we didn't know. We just had to buckle down, diba, and be strict
correct.
about things. But okay, that's good. So you mentioned earlier in terms of the what to prepare.
Yes.
No difference in terms of
No
hospital bag.
difference. No,
Same,
no
just masks
difference.
and
It's just the same.
masks and shields lang.
Yeah. Oh, yeah, of course.
Yeah,
And then
yeah,
well, you can bring if you want your PPEs and all that, but you're still in the hospital
yeah,
gown. But and also kasi,
yes,
if you come in, you already have a swab test that's negative. So
yeah.
you're in the negative
That's
ward,
true.
so the precautions are just like the normal precautions that you wear a mask, you wear a
Okay.
face
The
shield,
swab
but
tests are done where? You can do it on
in
your own?
St. Luke. No,
It's there
so
also. You have to
it's
go
done in
through.
St. Luke's, and
Yeah.
if you're delivering in St. Luke's, your swab test is free. You have one
It's part
free
of
swab
it.
test. Yeah, but
Okay.
yun lang. But now that they're requiring every 7 days,
Yeah.
you have one free, and then
Top
the
up.
rest you have to pay for.
Okay. Okay. Now let's go to what you mentioned earlier. What if the test turns out positive? How is that handled, or how is it managed?
Yeah, so we
Yeah.
have an area, a separate area.
Yeah.
Okay, totally separate. So St. Luke's Global and BGC and Quezon City, we're very fortunate also to have like certain areas that we can convert into a hot zone.
Okay.
So once you are negative and you go into labor, there's a certain area where we direct you to.
Okay.
Yeah,
Yeah.
so
And it's
and then it's like full
yeah.
PPE and all that.
Yeah.
And then you may be moved after to a ward, a COVID ward. So that's the only
Okay.
difference. Your baby, of course, will be monitored. No? So
Yeah.
maybe in terms of going home, so like normally if it's just a normal delivery, 1-2 days you're done. Cesarean section for me in my
Yes.
case, 2 days, maximum three. I can send
You're
home.
done.
Yes.
That's fast. That's
I
fast na.
I send home pretty fast.
Yeah.
Again, it depends on your doctor, how comfortable she is to send you home or not. But if you're COVID positive, then you're going to have an infectious disease doctor on board. So
Okay.
at the end of it all, she or he, that doctor is actually going to be the one to give the clearance for you to go home. So it
Okay.
could be now you're recovered now, okay, your wound's okay.
Yeah.
Obstetric wise, you're good. But they
Cleared.
have to,
Yes.
yeah, they have to check, your chest, your lungs, do you have pneumonia? The
Yeah.
baby, for sure they'd want to watch over the baby for a few more days to make sure that the
So
baby doesn't
babies are
get
also
sick.
tested as well.
Yes, yes.
Ah,
There
okay.
is a protocol. I'm not that much of an expert because I'm not a
Yeah.
pediatrician, but I know they do test maybe the first 24 hours, and then they have like a protocol and maybe they'll check a few days later again, just to make
Right.
sure,
Right.
because there have been like negative at the start, then positive a few days later and all that.
Okay.
Okay,
So
so
well, hopefully we don't go there. That's
correct. Kasi, and
so we always
also,
want negative.
I guess this is something we need to talk about, no? The cost,
Yeah.
no? The cost of getting pregnant now and delivering is
Right.
much higher, definitely, if you're going to test positive. Right now in the
Right.
surge, we're actually very full, no? So there's even a risk that you won't have an
Yeah.
institution to deliver in.
That's true. Oh, is it even?
Very
Oh,
hard.
really? Also
Yes,
in the
not in St. Luke's, but like in other smaller
in
hospitals,
others.
they're
Yeah.
actually calling us if we have room.
Ah,
And
of
they're
course.
going
So
to
they
transfer their
prioritizing
patients
the dire
to us.
cases.
Yeah.
I understand. Okay.
Yeah.
Okay. So right now how do you see cases of pregnant women being positive? Are there a lot? Or is it growing as well? Or is it remote? Or how's
With,
the experience like?
with the surge, there's a lot now.
There's a
And
lot.
mostly asymptomatic though. Thankfully, maybe, no?
Yeah,
I would say
thankfully.
thankfully asymptomatic. No? So you wonder where they
Yeah.
get it. That's why if you
Yeah.
notice when I mentioned to you the rules of the swab test, diba? They're stricter with the husbands. Like the husband dapat
That's right.
30,
3 days. Now
3 days
3 days.
before. Yeah,
Yeah.
ganyan. But
Mm.
the pregnant mom pwedeng 7 days before. At least
Yeah.
7 days validity.
Yeah.
Because I think our hypothesis is they get it from the husbands
The
because the husbands
husband.
go out. The pregnant women,
Yes.
usually they stay home
They
lang
stay
eh, diba?
home.
They
Yeah.
don't, yeah. Also
Mhm.
kasi nga, yeah, Janice, I don't think we touched on this. The pregnant
Sure.
woman is considered in the vulnerable group to get COVID.
Okay.
Okay, you are considered immune compromised. That's
Okay.
one. That's the first thing also pala I stress when a patient comes in pregnant. Maybe again, that's
Yes.
one difference.
Yes.
Na if you are pregnant, you belong to the group who are more vulnerable
Vulnerable.
to
Yeah.
get COVID because your immune system is lower. So yun nga, maybe you get your husband's the one that goes out, but he comes in and you get it asymptomatic.
Right.
Okay, so that's the situation. We're getting a lot more now, but nothing naman that we can't manage. I mean, there are still more negatives. Okay, maybe
Yeah.
let's put it
Yeah.
that way na lang. Parang
Yes. Still
it's
more
not
negative.
naman, there's still more negatives, but whereas siguro before we'll have one or two, we're getting a little bit more now.
Yeah. Okay. I guess people might be wondering, is it okay to get vaccinated if you're pregnant?
Yes, the recommendation now is that it's okay. Our society, the Philippine Obstetrics and Gynecological Society, actually
Hmm.
said that it's okay as long as it's after the
Yeah.
first trimester.
Okay. That's good.
Okay.
That's
Yes,
good.
and
Okay.
also for breastfeeding women, it's okay.
Okay. That's good to know. All right. Okay. So let's go to actual delivery.
Okay.
D-Day. D-Day. So for CS or labor, how does it go? So CS, of course, so you're ready, diba? And
Mm-mm.
then with if actual normal labor, well, of course, hopefully the tests have been done and you've been able to like what if it's early and it lands on the date? What happens if you don't have a valid swab test? Like and then biglang you go into labor?
You'll just have to
Biglang
pay
test.
for a very
Yeah.
fast swab
Fast
test.
test. Okay, okay.
Yeah, and you'll have to pay for that if you know
That's
what
an
I mean.
extra.
Medyo malaki,
Oh my
super
gosh.
extra yan.
Okay.
So yeah, so
Yeah.
what happens? There are cases like that. So but I told you, 9 months is 37, 38, 39, 40 weeks, right? So more
Yes.
or less what we obstetricians do to kind of help our patients just avail of the free swab. Kasi normally naman sa
Yeah.
37, you're not really in labor eh.
Yes.
Diba?
Yes.
It'll happen mga 38, 39, nearing the
Yes.
40th. So we have them swabbed here. And before, kasi it was valid for 2 weeks. So 1, 2.
Yeah. So
So,
one
so
test
patok
lang.
na yon. One test,
Yeah.
free. So it has happened to us before, to me, that I saw her here,
Yeah.
very close in my clinic and all that. Sabi ko, sige, next week ka na lang magpa-swab. Kasi, wala
Yeah.
pa. She came in that night, full-blown labor, right? But,
Oh,
you know, they
okay.
always understand naman na these things we're doing, it's just parang making a very intelligent guess. But at the end of the day,
Right.
you really don't know when you're going to deliver. So I do
Yeah.
give my patients the option. Would you rather, para you wouldn't be so scared, have the swab here and then pay for this na lang? This is just like what,
Okay.
about like maybe 5,000, right?
Yeah.
Versus we get caught and you're not sure,
Yes.
and this swab test will cost you like what, 9, 11, 12,000, right? Because that swab
Right.
test comes out in 2 hours. So I give them the option, but yun nga, so this with this patient, that's what happened. She came in at night. So yeah, so she stayed in the hot zone in the not sure area
Yes.
for about 2 hours. Kasi nga, they
Until the
swabbed
test
her
comes out.
first. Yeah, it's
Yeah.
called BioFire. So BioFire is a quick way to get your PCR swab test. And
Okay.
thankfully, she turned out negative. So she was now transferred to the regular. So that's what happens
Okay.
if you don't
Okay.
have a swab test. So okay lang naman. Medyo gagastos ka lang.
Yeah. Yeah.
So
Okay. So, well, the finances you have to prepare then. No? It's
yeah,
different now, but I guess with
correct.
everything as well. Just like with traveling, by extra, but
Yeah.
that's a whole other story, but part of it, right? So
Yes. Part
being
of it,
ready.
definitely part of
Yeah.
it, because
Yeah.
these things can also cause anxiety and stress
That's
to your
right.
patient, which you don't want them to
True.
experience. So you want
Yeah.
them to be ready. So I guess
Yeah.
if they ask about it, finances
Yes.
should be talked about.
Right. Okay. Okay. So let's go to giving birth. So
Yeah.
it's the D day. So when they come in, of course, so we already talked about the area being contained. So nothing to worry about there.
Yes.
Everything is the same. If
Everything's
as
the
long as
same.
the tests are done,
Correct.
in terms of the rooms, the suites where the pregnant and the new moms go,
Yeah.
contained
So
as well. So
so
nothing
it's
to
the
worry about
same.
there.
Yeah, everything is the same. I guess the really important one is the swab test. I tell
Yeah.
also my patients, and this one I say even before the pandemic, na don't
Yeah.
panic, because they're like, look, what if our bags
Yeah.
aren't packed? What if, okay, what do I have to
Yeah.
bring? What if I forget something? I say,
Yeah.
you know what? If you forget something, the hospital has it.
Yeah.
Okay? You don't have your
True.
clothes, there's a gown. Okay? You forgot your underwear. After delivery naman, they put you in those adult
Yeah.
diapers
Nappies.
Yeah,
Yeah.
so because it's
True.
okay, it's okay. It's like
Yeah.
if you forget from like things like you don't have like those baby clothes, no, mittens
Yeah.
or whatever, whatnot. The hospital has it. Again, of course, you're gonna have to kind of pay for that.
Yeah. Pay
But
for it.
if you're
Yeah.
just gonna get one lang naman, then you can maybe ask
Yeah.
someone to drop it. So, in other words, I always stress them to lessen their stress is it's okay if you forget.
Yeah. Yeah.
Pwede namang ihatid ng somebody else, di
Yeah.
ba? Parang
So that's
ganyan.
allowed, like sending things over.
Possibly, but I guess you can't
Yeah.
na lang, you can't enter,
Yeah.
right?
So it's
You
sent.
can't,
It's given
yeah,
to
you
you.
can
Handed over.
hand it
Yeah.
over. I guess the husband can go down, right? Because if you're in the
Yeah.
room na, you're free naman to move around the hospital. Okay?
Yes.
So
Yes.
yun, so those things. And then number two, I say, especially for first-time moms, don't panic. You don't need to rush. Like if you're feeling some contractions, there's room to wait. And I always joke then na hindi mangyayari yung parang sa sine na yung
Oh,
manganganak sa taxi,
exactly.
manganganak sa tricycle or
Tsaka
sa
wala na
jeep.
masyadong traffic, hopefully. So,
Oo. These things can happen when, like what, it's your fifth pregnancy, sixth pregnancy.
yeah.
But
Yeah.
usually, I'm not saying all, but
Yeah.
usually when it's your first time, it's not going
It
to take
takes
that
time.
fast. So you do have
Yeah.
time. You feel some contractions, have a warm bath first, you eat muna your dinner, see if you can go to sleep. If you go to sleep, that means that's false labor. Nakatulog ka di ba? But if it's
Yes.
progressing, mga siguro on your third hour na and it's getting very, very regular, then
Yeah.
you can go in. And then I also say na, what's the worst that can happen? If you come in and you're not yet in labor, they'll send you
Yeah.
home lang. But at least you have peace of mind, diba? So, kasi
Yeah.
mostly pregnant, they're like, it goes both ways eh. Parang either they're excited to go, it's too early, or
Yeah.
parang they're, oh, doctor said, I won't go muna. I'll wait for me,
Yeah.
maybe. But, they're so tense. So I said, if it's gonna give you peace of mind, just go. The worst case naman din lang is they'll send you home
They'll
na
send you
parang, oh,
home.
you're not
Yeah.
yet in labor, ganyan. So, but at least, diba, you're not like panicking the whole night thinking, should I go, should I not, etc. So, these are like my usual advices pre-pandemic pa, which also still
That's
holds true.
true.
And
That's
I give a lot of time to it because I don't want to add to the stress. So parang if you're relaxed like that, at least, diba, even with this additional stress of the pandemic, you're a little more chill when you come into the hospital.
yeah. Okay. So thank you for all this information. Even
You're
I
welcome.
am my fears or and worries for pregnant moms are a bit
Yeah.
more assuaged as well. So again, it's information that we need to arm ourselves with, so that we ease our worries, and at least Milan, you're so calm when you explain. So I love it, and at least it adds to the security as well. So siguro sa parting words, my last question for you before we go is your advice, your last piece of advice for moms and dads who are expecting and dealing with the changes that go with the pandemic and all. How do they take care of their mental health? How do they stay focused on preparing for their biggest role in their lives at this
Yeah.
point? So, what would be your last piece of advice for them?
Yeah. Well, I guess I think we mentioned this earlier when we were discussing
Yeah.
that really it's awareness and knowledge of what's going on to happen, no? And I find that true, really, for even my patients who are going into surgery. It may not be my obstetric patients. When they know exactly what steps are going to happen to them as they enter the hospital, what's going to happen next, and then where they will be brought in, etc., etc. They can sort of imagine it in their mind. So when it's actually going
Yes.
to happen, they're more relaxed. Okay, so
Yeah.
knowledge and awareness of really the steps, what's going to happen. Please ask your obstetrician. No, so all these things, I'll ask as many questions because all these things leading up to the 9th month will really help your brain or your mind kind of like make it
Yeah.
all sink in. So on the actual day, na you're not like panicking. Okay, I know that when I come in, they're going to ask for my swab test. They're going to interview
Yeah.
me, and I'll be brought into this place. And since my husband has a negative swab test, he can come in with me. So, parang you did it. You kind of
Yeah.
like thought of
Practiced
it in your
already.
head. Yes. So on the
Yeah.
final day, it really helps. It really helps in um, easing
Yeah.
the anxiety when you know what's gonna happen. Diba? Kasi fear is like
Yeah.
fear of the unknown,
You have
diba?
the unknown. Yes.
Diba? But
Right.
if you
Right.
know kahit paano what's gonna happen,
Yeah.
then then you're more relaxed, no? Then everything else is the same pre-pandemic. Just educate yourself, especially for first-time parents, right? Know everything that you need to know about pregnancy
Yes.
and the healthy things you have to do. It's still the same naman eh. Oh, but ano pala,
Yeah.
last, so the
Sure.
additional vitamins I give are vitamin C pala.
Right.
No,
More
additional
vitamin
vitamin.
C.
Yeah.
Yeah.
So normal aside from the regular vitamins, I request them
For
to
the
take
immune
vitamin C.
system.
Correct.
Yeah.
Yeah. So again, that's one tiny change lang naman. Nothing great.
Okay. Yeah,
Nothing.
the staying healthy is a protocol in even before naman. So just
Yes.
yeah.
Yes. Yeah.
Okay. Thank you for the tip. Yeah, be prepared. I mean, that's a good advice to visualize the process in the beginning. Like practice in your minds. The way what we tell our kids to like, diba, when you go to school,
Yeah.
it's the same thing, I
Yeah.
guess. So thank you
And
for that. That's a very
even the
practical
post-op
advice.
pain, even the post-op pain,
Yeah.
when you know it's not gonna be that painful.
Ah,
When you know parang,
that's true,
oh, you're
no?
gonna feel
Yeah.
like like your pusons like contracting, or that's just your uterus
Right.
getting smaller. Every time you latch, you're gonna feel this parang
Yeah, even breastfeeding,
pain.
diba? To
Yeah,
prepare
diba?
yourself that it's not like in the TV or the magazines that it's natural. It's like there's gonna be a bit of
Yes.
discomfort when you first latch. Yeah,
Yeah.
same.
It's the
Be
same, di ba? And
prepared.
then I say, you welcome that pain because that means that your uterus is
Your
getting
uterus.
smaller and you're not going to be bleeding. So then they get it and then, okay.
Yeah,
If that's not explained to them, they'll be panicking the whole night
true.
before I do my rounds na parang, oh my gosh, masakit. Is my wound
Mm.
opening? Di ba? Ang dami na, di ba?
That's
Mga
right.
ganon, right? Is my wound opening? Baka merong ano, ganyan-ganyan. Ay, sugat san si doktora? Eh, gitna ng gabi, di ba? So they're like panicking until the time that I actually see them the next
Yeah.
day. So, just these little cuentos,
Okay.
it really helps.
So at least it pays that you're really patient in explaining everything, and
You have
then
to be.
so moms and dads just write down everything and but just arm yourself with information,
Yeah.
and then breathe and be mindful of how you take on what's coming.
Yes.
Everything from pregnancy, labor, delivery to post. That's true. Post
Yeah.
pain, breastfeeding, and taking care of your new baby.
Yeah.
Okay, so thank you, Milan, for that. May we
Welcome.
ask you to give your contact info in case people want to contact you, set an appointment? How do
Um,
they reach you?
I guess they can contact through my secretary.
Yes.
I can give the number of my
So again,
secretary.
Dr. Milan Abaya is in St.
Camille Abaya. I think I'm not
Camila
sure if
Abaya.
it's
That's her
Milan. Real
official name.
name. Official name. Yeah.
She's in St. Luke's, Quezon City and Global.
Yeah. So the number of my secretary is 0975-609-4578. Or you can just
Okay.
call the St. Luke's trunk line and, ask
That
for them.
connect.
Yeah. Well, we're
Okay.
not always in clinic, but I think they have the
Yeah.
number of my secretary.
Okay. So thank you again, Dr. Milan, for joining us. I learned a
Welcome.
lot, and hopefully this will help moms to be and dads to be more armed and ready. Okay, so thank you everyone for listening in on You the Mom. And just remember, mom life is something to be celebrated and cherished. And we at Mommy Mundo believe that all moms should be celebrated and cherished too. So from us to you, we say,
You the
You the
mom.
Mom.